I'm Fiona and I'm the development worker at Tillyjohn Community Flat. I'd like to take this opportunity to outline our application for Locality Improvement funding with reference to alcohol and drug work in the Tillyjohn area of Aberdeen. Addiction and substance misuse are problems that can affect individuals from any background, of any race, any culture, any gender, and at any age. Addiction has no boundaries. It doesn't matter how educated or how wealthy you are. Addiction doesn't care about wealth or about education. It doesn't care whether you're homeless or whether you live in the most affluent area of town. Addiction does not differentiate. Breaking out of the addiction cycle can, however, be harder where poverty is an issue. Rehabilitation services are few and far between and are often prohibitively expensive. Mental health services are overstretched and scarce, and waiting lists are at an all-time high. While physical addiction and detoxification may be dealt with through appropriate medication, the psychological dependency is much harder to break. Psychological dependency is the most difficult and complex part of any addiction, and without adequate professional support, it can be almost impossible for those struggling with these issues to move forward. Breaking the addiction cycle can mean dealing with thoughts which have been suppressed for years. Substance misuse is often used as a way to self-medicate, to deal with problems. And suddenly finding yourself without that support can be very difficult. Tillyjohn Community Flat is a well-established and trusted neighbourhood charity, known for supporting and for providing a welcome space for some of the area's most vulnerable residents. We have previously run a pilot counselling scheme, which was a great success, and we are keen to tailor this to assist those who may be battling with addiction. We have met with a hugely experienced addiction counsellor who is keen to work with us in providing vital support through counselling sessions and group work. This will benefit those who participate and also their families and friends and the wider community. We hope that some of those who benefit may be able to assist with informal peer-to-peer support going forward, so that there is always someone available who understands and who will listen. The Tilly Flat is well situated to provide this, having the space and having the trust of many local residents who may not be comfortable engaging with support services outside of the area. If our proposal succeeds in securing funding, we will be able to fund an experienced counsellor who will support these struggling with addiction to a hopefully brighter future. There will also be an opportunity for myself and my colleague Sarah to have some on-the-job training to enable us to better support those who may need it. Moving forward, we would work with participants towards ideas for group activities, utilising our garden space, hosting informal weekly drop-in sessions for those needing encouragement, and encouraging participants to come up with their own ideas for activities which may be beneficial. We see this as a much needed service for the area, especially after the past year where the pandemic has caused a backlog in face-to-face appointments and person-focused support. Lower levels of addiction and substance misuse mean a safer and happier and healthier community for everyone. Thank you for considering our application.